Okay, so first off, does everyone know how to sex the animals? No? Let me show you. Okay. So the main things we want to look at to sex the animals is the distance between the urinary papilla, right? There's going to be something that sticks up here, whether it be male or female. It may be a little bit longer in a male, but it's really not dramatic, right? So don't rely on that. So we're looking at the distance between that and the anus. Okay? Realize if a female's sexually mature, there will be two openings there. The anus is the one that's closest to the tail, right? As you would expect. But if it were marsupials, it's different. So this one, the distance is pretty far, right? This animal also has its testes have started to descend. That's what you're looking at here. And so this one's a male. That one's a nice, obvious male. When they're young, males and females can be pretty difficult to tell apart. Let me just show you a female really.
There's only 2 females in there.
Okay. Oops. There we go. So you can see here, here's the urinary papilla, there's the anus, right? It's pretty obvious, okay? And she's not mature yet, so. Okay. Try to use the scissors as little as possible for cutting through the skin, because nothing dulls them faster. They're all really dull, but let me tell you, they get dull really fast, and it gets ridiculous to keep buying new scissors because it literally gets dull in about the third animal you dissect. So use the blade as much as you can just for opening the body cavity. And so I'm making a very superficial incision here. And then I use my fingers quite a bit for this. So I'm just pulling this open. And you see how I haven't even gone into the body cavity. This is where a lot of people who maybe have watched too many medical shows are really uncomfortable with using their hands on things. This is not surgery, and they don't feel a thing. So use your hands. Okay, so the first thing I'm going to do is the liver. The liver sits right here. So here's the sternum, there's the ribs, liver's right below it. I'm going to open the body cavity, and here I don't mind, I use scissors a lot more once I have the body cavity open. And I'm just trying to cut that membrane. Right, so these are the quite thin abdominal muscles. Oh wow, those scissors are bad. Okay, this is my trick for collecting the liver. When I collect a liver, I hold the animal in my hands and I allow them to bend like this. What this allows me to do is I'm just kind of peeling things back here. Grab the liver from where it's attached. And so I really am not seeing the attachments, but see how when I hold it like this, I can see where the top of the liver is? Mm-hmm. And all I'm doing here is, the diaphragm's right above it. So you'll see a thin red layer above, like a little wall there. I just reach in behind it and pull. Oh, we should do the spleen on these animals too. And then I'm just going to sever any little connective tissue or anything that's holding it in, because we'll clean it off afterwards. And so then I want to make sure that I didn't miss anything. So look, I missed a bit. So that's a bit of liver. And we're just weighing it. So you know what? If it breaks, it doesn't matter, right? It doesn't have to be perfect. It's certainly easier if it's relatively intact. I've got some stuff here. I'm going to look at that. No, that's liver tissue. Okay, so that's good. And then this is my gross habit, but it works really well. I usually roll the organ around on the back of my glove and look to see if there's anything that looks like it's not part of the organ. Because then if I see stringy membranes or anything, I want to trim those off. The other thing I want to look for is the gallbladder. And that's going to sit between the two lobes. And I kind of saw it when it broke. I think it was right here. Okay, and it was teeny tiny. But if you have a sizable, so it was sitting here, it would have been a little green balloon. You want to make sure you remove that. If we were to then use the organ for mitochondrial respiration, that bile can inhibit mitochondrial respiration, so we want to take that out. We'll see what the rest of them look like. It can be really big, but I think in these animals, they're so young, there's just not much yet. Okay, so that's the liver. The other nice thing is the fact that I rolled it around on the back of my hand. You know what I just did? I removed all that superficial blood. And that's what I do to get the superficial blood off. So welcome to my gross habits. It actually works perfectly. So that's the liver. Since we're down here, let's go ahead and do the gut now. Okay, so the gastrointestinal tract. The stomach is always going to be on the animal's left, so that's right here. I always think the stomach in mice is kind of fascinating. So this anterior portion of the stomach, the tissue is really thin. You see how it almost looks fatty? What you're seeing there is not fat. It's actually the color of their food when it's digested. In the past, we've done studies where we had different diets, and you want to not mix up your diet, so we had them dyed different colors. And of course, what colors did we use? Orange and blue. And then you would see that color at the top of the stomach. So this is the thinner cardiac area, and then this is the thicker area at the bottom. So, but we don't need the stomach. We want to take just posterior to that. So we're going to look at the stomach here. And so for consistency, let me draw a picture what I'm looking at here. So the stomach is here, and let's cut it right there. Okay? And so you can kind of visualize where it comes around and cut. Okay, obviously we're going to take out the whole gastrointestinal tract. Oh man, was that? How old was that animal?
28 days today.
She's got oh no, that's fat. I thought it was a uterus. She's got a lot of fat around her uterus. Okay, so the colon. So we want to pull things away, but that can just flop over for now. So that we can find the descending colon here. Okay, this is the bladder. And we want to go ahead, and it's going to come down behind the bladder. And we're going to cut essentially right behind the bladder. So just take your scissors to as far as they go here. I'm not pushing hard, but it's going to stop. And we'll use that natural stop as the place to cut. Okay. And then we can pull this out. Okay, now this is where things get a little tricky because we don't want to stretch the intestine, but we're ultimately going to pull it and stretch it out so that we can measure the length, but we don't want to make it longer than it actually is. So that means we just have to be really careful as we do this. And so, and there's membranes that are holding it in. So I'm kind of teasing around and trying to see what is and what isn't intestine, and it looks like these are just membranes right here behind it. I'm going to cut that, and here we go. Okay, now I'm a little out of practice. I haven't done this in years, to be honest with you guys. Let's see. I'm looking for an end that'll give me a place to start as I kind of unravel it. And I'll bunch back up. Let's see. So there are going to be membranes here, right, that are holding things together. When I'm sure it's a membrane and not, man, these scissors are bad. Not the gut. I can cut it because that'll help it to unravel. Still haven't found. So mice have a really large cecum. Does everybody know what a cecum is? Yeah, okay. Well, so we'll see that. There's going to be a big pouch. Oh, there's an end off the side of the intestine at the intersection between the small and large intestine, right? I think this is the descending colon here. Okay, so at this point, you're going to have to trim because there's a lot of membranes that are kind of keeping everything all bunched up. And so you see how I'm really kind of carefully doing this to try not to stretch it. I think those are my two ends. This is going to take a few minutes. Here, let's put this guy on. Bunching up the intestine tend to keep us from pulling it straight. And so we want to try to pull it straight so we can get the total length. And so that might if you see it's kind of bunching it up, then you want to cut the membranes at that place. So I'm actually going to just use this because I can kind of stretch it out and see, and I can just cut, and that'll allow that to stretch out a little bit more. There's the cecum right there. There we go. There's a bunch of tissue right there that's holding that bend there. And I personally find the easiest way to get the length is once I get this all stretched out. See, there's another bit where there's a bend. And carefully, you want to try to do this without cutting the intestine. I find the easiest way to measure it is to actually just mark the foil and then come back. So this is a little right at the end there, so that's going to be my total. And the other thing we can do here is we can go, you can see right where both the small and the large come into the cecum. And so we can go, this will be our large, and then this will be our small. Okay, and I think we can probably get our cecum length too. Yep, that's stretched out pretty nicely. And so we'll lay it alongside here so that we can go bottom to top there for cecum. Okay, so that's where we'll get, this actually wasn't the straightest, was it? Okay, now to weigh it, we need to flush it. This is where I have not done this in a while. We'll see how well it goes. Okay. And in fact, what we're going to do, we're not going to, if we, we're going to clean it and weigh it and then flush it. If we try to, so when we flush it, we're going to use saline. If we weigh it after we do the saline, it's going to be hard to get the water out. So we're going to be consistent about the way that we weigh it before, and that'll be after we're going to do a first pass cleaning it out. But what's going to be important here, so you see I cut both the large and the small right where it attaches to the cecum, okay? If we're going to weigh this thing, we need to try to get off excess connective tissue to the best of our ability. So you see here how I can kind of catch it and pull it out. It's not too bad. Yeah, this looks okay. Yeah, this one's bad. So we want to have minimal extra. It's not going to be perfect. If we get it absolutely perfect, tell you what, we won't, we're going to end up cutting the intestine. Okay, so that's pretty good. Okay, now to clean it, actually, I think I'm just going to use the back of this. We want to carefully press the contents out. I don't want to lose my markings here. This is where it might be trickiest in the small animals, is doing this without causing too much damage. Yeah, that blew out. Okay. So this is forming how we're going to flush it too. It's making me think about methods here. Okay. So we want to press the contents out to the best of our ability. And let's plan on, and I may change this later, let's plan on flushing and collecting a sample from the middle of the intestine. And so that means be really careful around the middle and pay attention to where there's an area you haven't accidentally pressed things out the side, right? Harder than I remember. Oops, I think I took, no, that's just, okay. Okay. Okay, so that's pretty good. Okay, now what we're gonna do, and this is, I might change this method a little bit later, but we wanna get a measurement of the width. And so we really want this in it. Let's take this measurement, kind of eyeball it and go, okay, what's the middle, okay? And then we wanna have it nicely laid out. And then has everyone used calipers before?
Nope.
Okay.
No.
These aren't my favorite calipers. I'll have to show, I'm gonna have to look at this one for a minute because it's a little bit different than what I use all the time. But they are all a little bit different whether they have a dial or not. But we're gonna use this and we're gonna get the width mid-intestine, okay? And you wanna be really precise with that on each side. Hit each side carefully of the intestine without squishing it in, okay? And so, let me get this right back where it was. Okay, so this one is, man, this has centimeters and inches on it. Centimeters on the bottom, okay? So it's gonna be where this lines up. And so this is gonna be, that's a full centimeter. So that's 1, 2, not quite 3, it's 2.5 millimeters. I'll find some better calipers. I think our other ones are more, I know they're more precise than that. And we'll come back later and measure those. Okay, so now that we've measured this, I'm gonna take that midsection and let's take I'm just looking at the length here. Let's take a 2 centimeter section. So I'm gonna go from here to here. Okay. So I will have already divided that, but we're gonna weigh this before we flush it. Okay, so now we're gonna have 3 pieces that we need to weigh. You wanna zero that on the scale for me? Is it 2? Thanks. So this little piece in the middle is what we're gonna flush, and then what we'll save. Put that there where we can find it again. Okay. Yep. Just to go through the process. And then we'll have data sheets that we
0.309. Say 28.
Okay. So we'll record, that'll be the small intestine mass. And then I'm going to, for now, I'm going to take some PBS. I'm going to put that in my Petri dish. There's no reason to fill it up, just a little bit in there. And I'm going to take, thank you, I'm going to take that small piece and I'm going to put that in there for right now. We'll come back to it. Okay, so now we're going to do the same here with the large intestine. Clear it out. It's starting to get dry. So don't work too slowly. It's a little bit harder once it starts to dry out. And this was pretty empty. Most of the food was in the small intestine. Okay. And I might change exactly where we do the measurements later, but Halfway through again, I'd take the measurement. We're not gonna, I don't think we're gonna cut anything out of large, but we'll see. I'm not gonna worry about it today. And then this is 1.5 millimeters. Okay. And then we'll get the weight on that. So so I was hoping to use 1 mil syringe. These don't have a needle on it. It's nice to not have a needle because then you're unlikely to poke it. But I'm definitely going to need a needle solution through it to clear it. And so I'm going to take the end. It seems like it's in the best shape. And tell you what, I think we should definitely set up a magnifying glass for the future. For doing this, we do have some around, but not right here. Okay, so I'm gonna get it and see how I'm carefully putting it, and I'm like moving it around so I can see that it's in there nicely. And then I'm gonna push. Oops, and it came right back out the other side. That's not what I wanted. Got it in nicely last time. Come on. There we go. Here we go. Come on, come through. Yeah. This will be easier if we have larger animals for sure. Okay, play with that. I'm likely to modify this.